Hey, EVAPH family. I'm here to dive into dog allergies with Dr. Goodman. She's going to go through all the signs and symptoms and everything you need to know to determine if your dog has allergies and what you need to do about it if you think they might. So let's turn it over to Dr. Goodman.
Thanks, Jen. So, what I find amazing is when Jen was introducing the topic that we were going to talk about, you may have noticed the dog that's in the picture with her. That's my new girl, Fiona. So, right when Jen said the word allergy, it was like right on cue, ready, set, action. And my dog started scratching her leg because my dog actually does have allergies. So, that was pretty good intro there, Jen and Miss Fiona. So we live in the Ohio River Valley, and that means that we all, at least most people that I know, have experienced allergies themselves. So you, as your fur baby's caretaker, as their human, have experienced what typically you think of with allergies is like the hay fever type symptoms with sneezing and snuffling and maybe some coughing and congestion. Well, animals can also be allergic to absolutely positively everything that we are allergic to. That includes pollens, weeds, ragweed, molds, trees, grass. They can be allergic to dust mites. They can be allergic to cat dander. They can be allergic to themselves. I literally, in the 20 years of practicing, which I just dated myself, actually have had two dogs in my career that were allergic to their humans. Yep, you heard right. They were allergic to their own humans. And they were cases that were really hard to figure out what was going on until we ended up doing some allergy testing and referring to a specialist. So a lot of people get really confused when we tell them that this hot spot or this skin infection or this chronic ear infection, even though it's only the one ear, not both ears, or it's both ears, or the infections in the ears just keep coming back and back and back. They say, well, how is this an allergy? Well, you have to think about it in terms of they actually absorb those pollens, those molds, those everything that's circulating in the air in through their skin, and then their immune system reacts inappropriately to them. It attacks the immune system, and that's why typically for years the treatment was steroids because that was the only treatment that was available, and steroids actually help decrease the immune system from attacking its own skin. So that's why you get the most common signs that a lot of people think of with allergies are the scratching, the itching, the ear infections, but also the allergens can also affect your GI tract. We can have some animals that will have chronic diarrhea. And when they have chronic diarrhea, along with itching of the feet and itching of around their private area, their butt, those animals, we start thinking about, okay, is this some kind of intolerance to the food? Or is this an allergen that's causing them to constantly just grind at their feet and have loose stool on and off? And then we go down a route of a food trial with a novel protein that they've never been exposed to. It's a horrific world of the allergies. And the reason why it's so horrible is because, one, you as their pet owner, you see them. It's affecting them because they're constantly scratching. They're miserable. Sometimes it's seasonal, so it only happens in spring or fall. Sometimes it ends up being all year round. And when you can actually see how badly it's affecting your pet, that pulls at your heartstrings and you just want it fixed and you want it fixed right away. And so do we. And if I could do that, I'd be a millionaire and I'd still be doing what I'm doing because I love what I'm doing, but maybe I'd be diving a little bit more often. There isn't a quick fix. Just like in humans, there's no way to cure allergies. And that's what's so frustrating as well. They keep you up at night with their scratching, their licking, the slurping. We're all aware of it. It's just miserable. They're miserable. Everybody's miserable. And they don't typically get that classic hay fever, but they do sometimes, depending on the animal, they will get runny eyes. They'll get some goop from some of their eyes also. They'll do this thing called a reverse sneeze. And if I were really good at making the noise, I would for you, but I am not very good at it. But they get real low to the ground and it's like they're trying to suck in air and it's like they're a reverse snort almost. And then they gag at the end. And that's a sign sometimes of allergies as well. So as you can see, there's a whole cascade of what can happen. So we all want to cure this, but the frustrating part about it is there's no one pathway to figuring out what is the problem. We go down the pathway of doing food trials depending on the clinical signs, whether it's seasonal, all year round, what part of their body they're itching. A classic flea allergy is they're scratching and digging at their back end. And we actually have to treat the secondary infections that occur. There's newer medications out there, such as Cytopoint and Apoquil, that have been literal game changers for our fur babies with allergies. And then, really, one of the best things too is when we get to that point where it's just recurring over and over, is actually going to see a dermatologist. There are several in the area, and we will work through everything till we get to that brick wall where we can't go any farther. And we will refer you to one of the dermatologists for the correct method of skin testing and blood testing. The gold standard is skin testing, just like a human is skin tested for allergens. And then a specific cocktail is actually made for your individual fur baby to actually give them the immunotherapy or the allergy shots that they need to keep them from itching and scratching. We use a lot of supplements also, and a lot of topical shampoos that are soothing. Omegas are great for it. We really want to keep that skin layer as healthy as possible. We recommend standard process, which these are all things that you can call the office, and my staff would be very, very happy to talk to you about and point you in the right direction, or have you bring your fur baby in and have one of us, one of the doctors, myself, Dr. Weimer, Dr. Galitza, take a look and start going down that pathway. Because the other thing that can cause skin problems too are internal problems, such as hypothyroidism. So as you can see, there's so many different things it can be, and that's why it's so frustrating, and that's why we want to be here to support you, and we're going to be with you that whole way through that process of diagnosing what's going on and trying to help your fur baby and trying to help you and them sleep through the night.